All right. I'm going to go ahead and get started. Welcome to our first webinar of 2023. We are so happy to be with you and excited to introduce you to three amazing change makers from around the globe today. My name is Becky Ramsing, and together with my colleague Daphne Altima Johnson, we work for the Johns Hopkins Center for a Livable Future, and we work at the intersection of the food system and public health. We have been advisors to the Meatless Monday campaign since it began nearly 20 years ago. In fact, it's celebrating its 20th anniversary this year. So we are excited to be, this is a timely webinar, and we are so excited to start. So today, we are here to discuss and share the potential of Meatless Monday and similar meat reduction programs to impact health and food systems around the globe. Meatless Monday started in 2003 with a simple message of 1 day a week, skip the meat. Though it began as a public health campaign to address the overconsumption of saturated fat, this simple concept has relevance to our planet's health, the environment, water, climate, and even soil and biodiversity. So why is this important globally for everyone? We know that healthy diets are higher in plant-based foods such as vegetables, fruits, whole grains, and legumes, and then lower in red and processed meats are associated with better health outcomes. Studies support lower risk of diabetes, heart disease, and total mortality when red meat is replaced with healthier alternatives. This diagram here shows the impact of how we grow and produce food in the red areas, and how that has the impact that it has on the climate, on land use, on water use, on water pollution, and biodiversity. And the main proportion of these red areas is attributed to feeding and producing animals that we eat. This impact differs across countries because we don't, go ahead and move the slides, Daphne, sorry. Yeah, you are right on, good. Yeah, perfect. So right, so this impact differs across countries because we don't all eat the same foods, and we don't have the same access to calories, proteins, and nutrients. This diagram is a little confusing, but I wanted to show it to you. It's the diagram of the per person climate or greenhouse gas footprints of the same dietary patterns in 5 different countries. The different colors you see are food groups. The red is beef and other ruminants. The blue is dairy, and the green are vegetables. It's hard to see, but as they move from left to right, the diets there have more plants and less meat. In Brazil, on the left, where they produce and consume more beef, the overall footprints are higher, whereas in countries like Indonesia on the far right, their diets are lower in red meat and dairy, but they often are also lower in calories, protein, and important nutrients. Because of this and so many other aspects of our food system, the approach to changing diets must look different in each country. New slide. We have a global problem, but solutions need to be localized. We have found that over the years that Meatless Monday actually offers a perfect entry point for many of these solutions that we are seeking. We can talk about health, climate, agriculture, animal welfare, and more. People who have never thought about changing their diet may be willing to make a simple change 1 day a week. It can be implemented in schools, workplaces, homes, and restaurants. And it's a global movement that reaches over 40 countries and counting. Next slide. I'm so very excited to talk with these 3 change makers today who have taken Meatless Monday or this whole concept and applied it in very, very different ways toward a healthy, more sustainable food system. I'm going to introduce our guests all together now, and then we will start our panel. During this time, please use the chat to put in your questions and answers, and again, also use the chat to tell us where you are from today. So our first speaker is going to be Sylvester Segbaya. He works with the Johns Hopkins Center for Communication Programs in Ghana. He has led major public health projects in Ghana for over 17 years, and he currently coordinates the Ghana Meatless Monday campaign. He also serves as chief of party for the USAID Breakthrough Action Project in Ghana. Our second speaker is Priska de Lima. She has been involved with Meatless Monday Indonesia for the past year. With a PhD in environmental science, she is a keen socio-environmentalist who always enjoys humanitarian and multidisciplinary social science research. She loves to work with her communities, especially in capacity building sectors, which also enriches her with lessons and learned and findings from the field. She goes meatless on Monday, but she also eats seafood and varieties of local edible plants on other days to maintain the food sustainability of her country. And finally, Melinda Hu, who is the executive director of the Good Food Fund in China. She has more than 15 years of working in corporate social responsibility. She was responsible for the planning and implementation of sustainable development in the of agriculture products and the commodities and strategic sourcing's international team of Mondelez International. She was the Asia Pacific ethical sourcing manager of Kraft Foods and Cadbury, and had established a responsible sourcing mechanism in the company's supply chain. Before joining the Good Food Fund, she successfully launched and implemented farm animal welfare programs in China at an international NGO. So we are happy to have all of you with us today, and we will go ahead and get started. So I'm going to start with Sylvester. And Sylvester, tell us about your program, and when you were told initially about starting Meatless Monday in Ghana, what were your thoughts? Specifically, how did you have reservations of how it might work, and how did you make it work? So go ahead, you have about 5 minutes, Sylvester, to share with us today.
All right, thank you very much, Becky, and well, good morning, good afternoon, good evening to all of you listeners. So in Ghana, we were excited about the opportunity to introduce this whole campaign because obesity has become a big issue in our urban communities, and then also non-communicable diseases are beginning to be rising. They actually rising to the top of the scale when we talk about diseases that are contributing to mortality within our population. For those of you who know Ghana, Ghana is a lower middle income country, and a lot of people have disposable income, particularly in our urban communities. Now, so the idea of wanting to introduce a concept, a lifestyle modification concept that will help people reduce the risk of non-communicable diseases was exciting to all of us here. And then we thought, who are those going to be the ones who champion this campaign? Who is going to drive who is going to actually get people excited about it? What should we do with policymakers? Who are our main target audience, etc.? So in-house, we had a quick brainstorming session and identified some very key players. We looked at the policymakers. So in Ghana, we have the Ghana Health Service. They have a dedicated department or division, actually a program, which is called a Non-Communicable Diseases Program. So we thought they were a key player. Then we had the nutrition department also of the Ghana Health Service, and they obviously will be interested. So we thought they were going to be one other key player. Then we looked at, in terms of policymakers, we also thought of the Environmental Protection Agency, because for Meatless Monday, we're going to look at both the benefits to human health as well as the environment. So we thought the EPA was a key stakeholder in there. Then again, we thought about private sector for a number of reasons. They are the ones that are like super busy, very intense work activities, but then also they also throw in a lot of disposable income into the system. So private sector was a target audience because they have players that probably have sedentary lifestyles and do eat all the odd hours of the day. And we thought that it would be good to engage them. Civil society for all the good reasons. So we thought about NGOs, we thought about the church, religious organizations, churches, the mosque, the Islamic groups, other religious institutions. Then professional bodies. So the Medical Association of Ghana, the Pharmaceutical Society of Ghana, the nursing and midwifery groups, etc. So we reached out to all of these. Then the other key players we considered were those involved in the culinary industry. So the chefs in Ghana, we have what we call the chop bars. The chop bars are local eateries. And so we considered whether we could find people that were involved in that industry and brought them all together. Then we had women groups, and we considered the various women groups. We got a representation from a slum community within Accra, which is the capital city. And we brought all these people around the table and did a brainstorming session, did a sensitization session first of all, and then did a brainstorming session on how we want to roll this out. Then we also brought them together again for a strategy development session where we came up with a mission statement, a vision statement, and then we discussed how each of them were going to actually help roll out this awareness creation campaign. Now, there were some groups that were super upbeat, and the picture you see on the screen is chefs from different countries. So the Chefs Association of Ghana actually approached us and said, you know what, we do annual chefs cooking competition, which they call the West African Food Festival. And this year, which was last year, actually, 2022, Ghana was hosting it. Like, good idea, we want to partner with you. So they agreed that we sponsor a meatless dish competition, which we did. And the chefs from across, I think there's like 6 countries. On the screen, you see one chef from Liberia preparing her meatless dish. And they did this competition. Was great. They showcased a lot of brilliant ideas. And as much as possible, we try to keep this indigenous. So the chefs also looked at what would resonate with the communities or the populations that they dealt with. The other thing I just want to highlight at this point is the fact that we engaged with institutions that had employees or workers that had very busy lifestyles. So as part of our rollout exercise, we reached out to the banking industry, we reached out to the Christian Council of Ghana, the Islamic associations, and then we reached out to the women groups. Now, we've been lucky, I will say. We've had the opportunity to engage 3 very large banking institutions in Ghana. I'll mention their names: Stanbic Bank, we've had Fidelity Bank, we've had Prudential Bank, and they gave us great platforms. We sensitized all their workers. We had the opportunity to answer questions they had on their minds, and it was really exciting. So maybe I'll pause here at this point. So that's just a quick highlight on how we got started. I haven't talked about our development of SBC material, etc. yet, but we'll come to that later. Thank you very much, Becky.
Thank you very much. And I just heard that possibly the chat is disabled for the participants. We will be fixing that. So that's when you see that, please do add your questions and answers there. So we will adjust that. So thank you very much, Sylvester. Really great to hear. And I'm so, it's always so inspiring to see pictures of what you do and to hear how this program has developed in Ghana. So let's move across the globe to Indonesia. And Priska, would love to hear the same thing from you. When you were first told initially about starting Meatless Monday in Indonesia, what were your thoughts? And did you have some reservations about how it might work in Indonesia, which is such a different country than Ghana or United States? And how did you make it work? So I'll give you 5 to 7 minutes to share with us.
All right, thank you, Becky, and good morning, good afternoon, and good evening, everybody. Hope you are doing well. So, well, when we were given the idea of doing the Meatless Monday in Indonesia, at the first exclamation that, oh, really? Because like you remember the graph that Becky said, the consumption of healthy and nutritious food in Indonesia is still low, and meat is still considered such a luxury food for many people. And like the data in 2020 said that we only eat in average about 20 grams of meat a day. Meats means that it's a combination of beef, mutton, chicken, and also eggs, and also fish, seafoods. And then at the same time, Indonesia is still experiencing a double burden of malnutrition. So we still have the persistent undernutrition, we also have stunting and wasting that we still try to lower down. And then as an Islamic country, because the majority of people here is Muslim, many believe that being a vegan is not living in accordance to the rules. So when we had to do the Meatless Monday, they said, oh, really? But on the other hand, there is also increasing awareness, first in the environmental side, because we are aware, because we import a lot of meat, like beef, lamb, and also milk products, that there are some awareness in the people that there are increasing greenhouse gas and also the pollution because of the big meat industries. And also there are some increases in the awareness in the animal welfare. And also because of more awareness on the healthy diets and healthy lifestyle, especially in the young and urban population and educated population. So, and also just like Ghana, we also have a rising obesity and non-communicable diseases as well. That's really help us push this idea to the people, how doing this, the Meatless Monday in Indonesia. And one thing in the cultural background, there are a lot of ethnic groups in Indonesia that also have like fasting, like Monday and Thursday fasting, or also have a day without meat. So there, the idea of Meatless Monday is really, well, it is in our everyday life actually. And another thing that we are really keen of the idea is that we want to increase the consumption in vegetables and also the other plant-based products, food products like fruits, legumes, and also beans, things like that. Because the data shows that the consumption of really balanced food is still quite low in Indonesia. Because despite of we have a lot of diversity of edible plants, people don't eat. People seems to eat a lot. Just getting more nutritious food for everybody to get them more healthy and have a healthy lifestyle is our what we see as our patients in this program. So when you said, do we have any reservations? Well, first, we don't want to be identified as an exclusive group or the vegetarian or vegan group. We want to make it into a more balanced and nutritious food and give like very healthy guidance to the communities. And secondly, we don't want to go against the Indonesian government, who at the moment encourage people to eat more meat, eggs, and seafood to reduce anemia, because by doing that, the policymaker believe that we can reduce the chance of having stunting and wasting as well. So what we're trying to do in Indonesia is operating in the urban area, in the cities, where people have more access to the meat, and then get or introducing the idea of more healthy lifestyle by introducing more balanced nutrition. That's what we do in Indonesia. Thank you, Becky.
Thank you. Thank you. Really so different, but so what an excellent approach to just the new changing diets around the world. So now we're going to travel to China, and we're going to meet Melinda from the Good Food Fund. So Melinda, tell us about your experiences implementing a meat reduction campaign in China. You've been doing this a little bit longer than in Indonesia and Ghana. So you've had and working on a broader group. So we'd love to hear about your experiences.
Okay, thanks, Becky, and hello, everybody. And yeah, I'm Melinda from the Good Food Fund. Yeah, before starting, let me give you a brief introduction about our organization. We established in 2017, and the Good Food Fund is known to be a pioneering organization focusing on dietary and food system transformation towards a healthy and sustainable direction in China. And over the past 3 decades, with the rapid development of China's economy, the dietary structure of China urban and rural residents, has undergone major changes. Next slide, please. Although the nutrition deficiency has been greatly reduced, the rapid growth of animal food consumption and the increasing westernization of the Chinese diet have led to increased health risks and the environmental pressure. Next slide, please. In Chinese Residence Dietary Guideline 2016 version, the average daily meat intake is recommended to be from 40 to 75 grams per day. Around 2000, the urban population started to surpass maximum recommended daily meat take. 10 years later, the rural population has caught up as well. However, the public has little understanding of the stress their current dietary habits place on their health and the environment. Moreover, actually, many people who think that eating meat represents a high standard of living like Western countries, they believe that when treating friends to dinner or gathering with friends and family is not good and neglectful to choose vegetarian foods. This makes the message to reduce meat consumption very controversial. And at the same time, it is common belief among the public that reducing the intake of animal foods will lead to a nutrition deficiency. So next slide, please. So as an NGO who are working on dietary and food system transformation, our strategy is to encourage people to choose a plant-forward diet, like 85% plant-based diet. But in real life, it is hard to quantify how much of your diet is plant-based. So Meatless Monday is an easy way for people to get started. And in response to the challenge I mentioned, we've taken the following measures to promote Meatless Monday in China. Next slide, please. So first, we came up with the Chinese name for Meatless Monday, 蔬食 Monday, which means vegetables on Monday makes you feel great. We also have a slogan, Meatless Monday, feel great all week, which places emphasis on eating more vegetables rather than eating no meat. Actually, the objective of this messaging is the same, to reduce the consumption of meat, but the feeling it gives people is different. Next slide, please. And during the last 1.5 years, we have held a 7 Good Food Roadshow and joined a sustainability-themed art exhibition to different cities and hosting offline events. And we invited local chefs, health and sustainability enthusiasts to share and interact. The events include a plant-based meal and a presentation that introduces the Meatless Monday campaign and informs people how they can get involved. Next slide. Thank you. We translated and localized a large number of plant-based diet promotion posters and some educational materials provided by Meatless Monday headquarters and the Johns Hopkins Center for a Livable Future. We publish these materials every week at our social media and share them in all the activities we held, making them a common part of the people's media environments to gradually influence the target group. Next slide, please. We also provide training and certification for institutions participating in Meatless Monday. We publish a weekly newsletter, including activity news from those certified organizations who are going to hold activities to help them to promote their activities on Meatless Monday campaign. Next slide, please. And during the last years, every year, a Meatless Monday Kitchen God competition was held, during which we called on chefs to join the plant-based movement. Next slide, please. On the last day of 2021, we held a Millie's Monday New Year's Eve dinner Earth Relay, last like more than 30 or 60 hours, a live stream inviting partners to share their plant-based New Year Eve dinner with viewers around China. Over 50 plant-based practitioners and Millie's Monday partners from more than 20 countries and regions contributed to the live stream to show off their last meal of the year and share the story and cultural context behind the meal, creating the diverse and colorful feast of plant-based food from around the world. And a total of about 840,000 times people watched the live stream. So the above activities are our Millie's Monday China campaigns in the last 1.5 years. Becky.
Thank you, Melinda. Really interesting and just beautiful pictures of the work and the beautiful food that that you have created with chefs and families in China. Tell us, just before we move on to the next, tell us how you started identifying partners and stakeholders.
Yeah, okay. Actually, the first way to to identify the partners is to find them, to connect partners of the Good Food Fund's existing project, like Good Food Summit, Annual Summit, Mama's Kitchen, Eco Chef Program, Youth Program. They are our existing projects. So the stakeholders in this project, including the ecological farms, food companies, restaurants, chefs, and the food education organizations. So these organizations and the individuals have their own audience. So it means that we engage those organizations, they have their own audience that they can provide Millie's Monday to them. So for example, Mama's Kitchen's project target people who cook for their families. The Eco Chefs projects aims to influence the restaurants and the chefs, and the youth program targets students and young people, and the food education organizations target parents and the children. So this is the first way we identify the partners. And the second way is through Good Food Roadshow. And during the roadshow, and we can connect with many potential partners who have interest to implement Millie's Monday in their organization or in their communities. And the third way is by inviting influential people with different backgrounds and the audience to become Millie's Monday ambassadors. So yeah, next slide, please. Yeah, next slide, please. And you know, last year, the last one, yeah. Last year, we certified 4 Millie's Monday ambassador, animator, a dietitian, a health food brand leader, a chef, through them to influence different groups of people. And also we connect with more partners through them as well. So that's the 3 ways we identify the partners, yeah, in the program.
Thank you. Okay, now we're going to have a question for everyone, for all 3 panelists. I'm going to give you each a few minutes to answer this. So the question is, how did you assess your target audience and messages that would resonate with your population? So dig a little bit deeper. You've talked about it, talked about this some in your introductions, but you know, in each of these countries, you know, the audiences, the regions and the communities are very different, even within your country. So we'd love to know how you chose this target audience that you have, and the messages that would really, you know, would resonate with those target audiences. So I'm going to give you a few minutes. Go ahead and start, whoever wants to go.
Okay, maybe I'll just get going. Well, so first thing, we looked at who would consider this very critical to them. One, in Ghana, a lot of people think about their health. And so health became the major driving force behind our engagement. People are not too conscious and probably not very much aware about how meat consumption or meat production actually impacts the environment. So we throw that in from time to time just to create a lot more awareness on that rather than use that as the main writing principle. So based on that, we looked at people that would be concerned. So one, I'd mentioned earlier on that in Ghana, we have a lot of people who are predisposed to non-communicable diseases, hypertension, type 2 diabetes. A lot of people have, well, not too many may have gout, but quite a number of people suffer from these first two. Now, cases of cancer are on the increase. So we thought that these would be messages that will be like a wake-up call. Once we highlight that what you eat could potentially be aggravating your health condition. And if you do a lot more fruits and vegetables and plant-based diets, you might stay healthier for longer. So that became our main driving force. We actually started by doing some kind of baseline just to assess how many people implement any form of meatless diets in their routine lifestyles. The data did not show us much in terms of people numbers that were doing it. So we thought, well, this is a good launch pad to say your health can be much, much better if you do more plant-based meals. And then the other thing that we considered very critically was the fact that we don't want to introduce anything that sounds or looks foreign. We want to make it as indigenous as possible. So in packaging our messages, we said to ourselves that we have a rich variety of local dishes that are plant-based. And I'm sure the pictures you showed earlier on actually attest to that. So we said, you don't need to import anything foreign in terms of food that you eat. Just do our local dishes. We have popular dishes like fried plantain, beans with a little bit of palm oil, and gari. Gari is a local grain that is produced from, or a local cereal produced from cassava. And we said this is a very popular dish that a lot of people would take in the morning, especially those that do manual work, and it keeps them going for a long time. So say you can do meals like that. You can do a local jollof rice, just don't add the meats, do mushrooms and do some other veggies instead. You can do your regular banku and kenke, again, are very local dishes that we eat in Ghana, and you do them with some veggies, red peppers, green peppers. You do them with okra stew and add some mushrooms, add some garden eggs. So that was the whole idea, to make people appreciate the fact that you keep it local, you keep it indigenous, and it won't be expensive. It will actually reduce your cost. So we also tackled it from the economical, that most people initially thought it was going to be very expensive to do a meatless dish, and we said no, it's actually going to be cheaper because you're just eating your regular meal, but on Mondays you are skipping the meat, and so that makes it cheaper on cost for meat for 54 days in a week. And then we also highlighted forming and concepts that as you start doing it and you're with it, actually begin to lose some desire for the meat you consume, and you will not even realize when you start doing it 2 days in a week rather than 1 day, and when you eventually gravitate to the third day in the week. And again, as your health indicators begin to improve, so if you are typically diabetic and you notice that each week you do meatless Monday, your blood sugar levels are very well controlled. If you're hypertensive, your blood pressure is looking much, much better over time. You are self-motivated to sustain it. So those were the items that we use to actually attract our audience. I mentioned earlier on that we reached out to target audience that were typically predisposed to either non-communicable diseases or had stressful and hectic lifestyles that put them at risk. So that was one good thing. Now, the audience we're still targeting, which we haven't reached a lot yet, are the children. Now, we're targeting children specifically that are in the risk group 1, in the sense that they are children with parents who have a lot of disposable income, and they'll buy them lots of ice cream, buy them lots of pizzas, lots of burgers, and they are becoming obese, and childhood obesity and childhood diabetes is becoming a problem in the cities especially. So we're reaching out to private schools that have a lot of these situations. Beyond that, we want to target the children because they are major change agents. They can carry the message, talk to their parents about it, talk to their friends and their siblings about it, and then they actually become major propagators of the message on reduction in meat consumption. And then we try also to highlight a lot consumption of fruits and vegetables.
Thank you. Wow, really interesting. This approach and just really focusing on chronic diseases, health, obesity. So yeah, who would like to go next?
Well, I think it's my turn now.
Okay, Prisca.
It seems that I have to learn a lot from Melinda and Sylvester. It's really great to listen to both of you. Well, it is a bit different with Indonesia, bro, that we start with our identification of partners and stakeholders by discussions with the Health Promotion Department from the Ministry of Health and some experts in this area, because we really don't want to go against the government. And then by the networking approach, we start to shop around and then find the suitable partners, and especially from the like-minded group, because we believe that by networking, the balls can roll, and then we can, get more closer to the community. So that's what we do. And then we try to find some influencers, because we do a lot in social media, that really keen on the healthy food and healthy lifestyle. So they can also help us in promoting the idea of Meatless Monday and getting more healthy with that. So after we identifying the partners, we start doing the landscaping study with them. And then we study what is the Meatless Monday concept for the Indonesian people, because we really don't want make it into like such an exclusive group. We want this Meatless Monday Indonesia is available for everybody and can give good information about food and healthy lifestyle to all people. So we really want to have like what kind of the ideas from the community itself that can really work in the community. So, well, we don't want, because like the idea of Meatless Indonesia, we don't want to be like, just eat vegetables, because sometimes we refer it to, like a goat if people just eat vegetables, but really what kind of the idea that to make people more healthy with that, get more nutritious for that. So, because in several culture in our ethnic group, there are some guilty feeling if we cannot serve, the meat, and then it seems like we offer like a pure hospitality if we cannot offer meat dishes to our guests, things like that. So, and meatless mean that is well, it is a concept of food for people. But anyway, how to make it really resonance with the people? So. And then we try to link Meatless Monday Indonesia by promoting health and better lifestyle. And then after that, we move into the environmental perspective. So in this way, we can get the concept of the Meatless Monday Indonesia works really well in the community. So based on the landscaping study that I mentioned earlier, we just found out that being Meatless Monday in Indonesia is not just eating no meat on Monday, but it means that we have to eat more vegetables, fruits, legumes, beans, the other plant-based food and other products in the other day. So that's what we do in Indonesia. Thank you, Becky.
Thank you. Yeah, I appreciate how you talk about how you've gone from health perspective and use that to step into the environmental, which may be new for people. So Melinda, love to hear the approach in China.
Yes, thanks for the guest speakers. I also learned a lot from all your practices. Yeah, actually, yeah, 3-hour projects, different projects engaged a different group of people. Like for the Mama's Kitchen, we engaged like families. Families tend to pay a lot of attention to the diet of children and the elderly. So the most consumers worry that the diet without animal foods will lack of protein and negatively affect their elderly family members' health and also their children's development. So therefore, when reaching out to families in the community, we invite the dietitians to educate them how to put together nutritionally complete plant-based meals. And we also invite chefs to teach them how plant-based to cook and those plant-based cooking skills. Because, without meat, people may think that, oh, it's not tasty. So the chef will teach them the skills. Yeah. So this is to the families. And for the restaurants and the chefs, they need more information on why they should promote plant-based eating and whether any of their peers are doing it. Because, normally people go to restaurants, they want to order animal foods. So restaurants and chefs, they prefer to cook animal products. But we need to tell them clearly what's the reason why they should promote plant-based food. So to inspire them to begin exploring alternatives to animal products. So to reach out to this group, we invite successful chefs who has already practiced plant-based cuisine to tell their own stories of transition to plant-based diet and educate them how to create delicious dishes with plant-based products instead of meat. And yes, to change the ingredients from meat to plant to vegetables. Yeah. So this is the second group. So for the young people engaged by our youth program, for the young people, they are less interested in health because they feel they're young and their health is no problem. So this group of people tend to pay more attention to climate change. So when reaching out to youth, so we emphasize the diet of a healthy planet message and encourage them to participate in the important movements and to take responsibility for driving change. So we encourage young people to promote plant-forward eating and Meatless Monday in their schools by supporting them to design awareness campaigns and provide guidance and skill trainings to those young people. So this so to different group of people, we provide different informations to them. Yeah, thank you.
That's actually, and I find that's better about children to promote Meatless Monday and also endorse the climate change campaign, a very, very smart one. And I think that's something we would explore in Ghana as well. Thanks, Melinda. And I just wanted to also highlight the fact that we've engaged, we've always had dietitians in our sensitization meetings all the time. They do most of the talking. And when it's question time, 80% of the questions are directed at them, because people just want to learn the best portions of meals to do, how to prepare their meals the right way, etc. So the dietitians have been phenomenal, and we really appreciate their role in this campaign.
Well, as a dietitian, I'm really happy to hear that. So
yeah, very important role, to this program. Yeah.
Yeah, and just about the youth and their awareness here in the United States as well, their awareness of climate change and their fear of what their future is real. So yeah, we moving on. Just want to ask, maybe Melinda, while I have you, what were some of the challenges? Just 2 minutes. What were some of the challenges and successes you faced, in early implementation as you started?
Yeah, actually, Good Food Fund already implemented to plant forward concept in China for many years. But for those past years, we actually educate or communicate with a lot of experts or scholars in the universities. So those concepts and we delivered to them is no problem. But when we face to the public, they don't want to listen to the concept. They want to have some real, how to say, the real tools or the tips and how to do it, how to cook every day. And they need useful tools. So that's one of the challenges we faced. So last year, we also developed tools and then to tell them what's the issues, like their dietary structures, like maybe they use a lot of high salt, a lot of sugars and a lot of animal products and less meat and no whole foods, those things. So this is a very challenging point when we face to the public. Yeah.
Thank you. How about you, Sylvester? Share some of your challenges that you faced during early implementation of the program.
All right. So one, some big institutions we were targeting to reach out to, but I think bureaucracy just stopped us in the track. So that was one of our disappointments. The other thing we realized was that a lot of people, as soon as you talked about Meatless Monday, thought, oh, this is a very foreign concept, until we started engaging them. So then they were like, oh, this is something we could do after all. So just getting the mindset shifts from for most people, I don't even know whether I'll call it a challenge, but it was an initial roadblock that we just needed to deal with step by step as we engaged with the various stakeholders. Now, the other thing that came up was engaging children, which I did mention earlier on. Now, we have a mix of children. So apart from the urban kids who are children of, let's say, middle income people, we have a majority of the children within the country that may be suffering one form of malnutrition or the other. So we needed to do a very good balancing act. So we had some policymakers saying, no, we don't think that you should reach out to children with Meatless Monday. And we needed to have the conversation around, yes, we're not saying that the children should stay off meat because they need it to improve their blood hemoglobin, to make sure that they're getting the requisite amount of protein that they need in their food for growth, etc. But we want them to grow with it so that then they can be change agents as they move along. And we're just going to pick on Melinda's bit also to use them as climate change campaigners, so that they combine the two. So that became a challenge, and because of that, we couldn't scale up on a major scale, or we couldn't move extensively into public schools because they thought that the messaging wouldn't be ideal for them. But we're going to still revisit that conversation and see how we can make a strong advocacy for it. So I'll say those were the major issues that came up as we got started.
Thank you.
Thank you.
Really interesting. I'm going to move to Priska now. Priska, you could tell us a little bit about some of your challenges, but also about how your target audiences responded to the campaign. What kind of feedback did you receive?
Okay, starting the implementation of Meatless Mondays for us is really difficult because we have to find how is the right way to do it. And then, the starting point is usually, well, a big step to do. And then secondly is trying what is to communicate with them. So we really carefully plan our communications for the Meatless Monday. So how we try to make that it is acceptable for the communities that we have. For example, they don't really want, like Sylvester mentioned, this is a really foreign idea because we want to make it, this is in our everyday life, right? And then secondly, it is also a challenge for us to find a collaborative way to promote Meatless Monday in Indonesia, because we do have working with the partnership with other groups, and we engage with all of them. But sometimes to make a collaborative promotion is sometimes quite difficult, and how we disseminate the ideas of Meatless Monday, because sometimes we have the same idea, but they also want to focus on their own organizations, and then it is sometimes the collaborative way of doing the promotion is sometimes work and sometimes it's not working very well. But when you mention about the populations, what kind of the feedback? Well, we do have quite a good feedback if we working in the for young and urban and also middle and higher economic groups, because they are more open to the ideas, and then they want to try. Like Melinda said before, that they are willing to have new ideas, how creative ideas, how to cook and to try something and make it really try to make a nutritious food for the family, especially for the young moms. Yeah, so we really encourage our audience to share with us, and then we try to engage the audience more by sharing knowledge and recipes and how to really make a healthy food. But sometimes it is still a challenge for us as well to make the really authentic food from Indonesia, because usually we have a little bit meat here and there. So it is quite a challenge for us as well to do in the communication process. So I really like if Sylvester and Melinda also can share with us the recipes, because I know Sylvester already shared how to make fufu, but it is also nice to have another kind of dishes as well.
Yeah, later on, I think 3 of us can share recipes in the future.
Absolutely.
That would be so good.
And invite you to attend our annual year-end dinner. Yeah, really.
Wow, that's great. Thank you, Melinda.
Yeah.
We are all coming for dinner.
Absolutely.
So, Sylvester, just tell us just a few more minutes. Tell us what kind of how did your target audience respond to the campaign and some of the feedback you received? If you tell us.
All right. Thanks, Becky. So we've had a good mix of responses. We've had those who have gone like, this is the message for the season. You need to keep this going all the way. Then we've had a group of people who've come back with questions and are like, are you saying we shouldn't eat meat every day? And we're like, no, just Mondays. And then the follow-up question that comes is, are you sure one day in a week will make any impact? So what it tells us is that there's a lot more people need to understand. And so we're broadening our communication channels. Actually, we've been using a multiple range of channels. We've done social media, we've done television, radio, we've done print. So we have flyers that we give out to, different target audience. We have posters that we're getting the institutions that we have sensitized so far to put up in their institutions. There are the other set of audience that go like, can you help us actually track and see whether we're making progress? So we have an M&E plan in place. We're going to help the institutions we actually talked to them about having the peer support system where people pair up and say, look, I'll be a check on you, you'll be a check on me. Let's make sure when we go to the canteen on Mondays, we all do meatless, dishes. So that's been very encouraging. We've had a lot of other people saying, can you come over and talk to our group, our church, etc. So it's been very organic to a cost of medical, like the idea that what's the Meatless Monday, not in isolation, but also say, can you make sure you're exercising regularly and you're watching the portions of food that you the whole, the response has been good. Sorry, Becky, I'm done. Did you hear me?
Yeah, sorry, we're having a little bit of internet trouble on your side. I think on your side, or maybe mine. So, all right, thank you very much. Yeah. So we have as we are finishing up, I have 2 questions for each of you. We're going to go 1 question and each of you get just a few rapid fire answer to this question, less than a minute. So first question, we'll start with Melinda. If you had 1 piece of advice to tell others who wanted to implement a Meatless Monday campaign, what would that be?
Yeah, okay. So I think the important thing is to find a very to find a partner who share the same value with yours, and also whose strengths and weaknesses are relatively complementary to yours. So by working together and playing to your respective strengths, and you can form a much more powerful and impactful campaigns.
Very good. Appreciate that. Priska.
First, you have to have a good understanding on the context of what people think when they hear about meatless, and then how you can adapt the key messages. I think is quite important. And then afterwards, try to create activities related to the context, because people love engagement. So in terms of the culture, health, and environment. So well, engage like-minded partners, and also the Meatless Monday Global is quite good because we have a lot of support for you.
Thank you. All right, Sylvester, with 1 piece of advice for someone who wants to start a Meatless Monday campaign.
I think the biggest advice I'll give is adapt the message to the context of your audience. So we have a good variety of audience. We have people that are meat lovers. Show them how they can gradually work their way out of meat 1 day in a week. And for the children, the message should be packaged appropriately. So adapting the message to the target audience is critical.
Thank you.
Thank you.
So informative and really thoughtful in your responses. Appreciate that. Okay, last question. If you could expand or implement this program anywhere, where would this be? And what's your dream for your next step? Shall we start with, I guess we'll start with Melinda again, just in the same order. Melinda, are you? Oop.
It seems like she froze, Becky. Maybe go to the next one.
Okay, Priska. And we'll wait for Melinda to come back.
Yeah, I believe Indonesia is still a huge place to experiment this kind of concept. But probably Indonesia and the neighboring countries quite good, because we have a lot of like resources, quite the same resources, and we have like the same talent. Sometimes it's very good to introduce something that is near to our lifestyle, and then how to make it different, probably more engagement between one community groups to the others. So it's I think what we do.
Thank you. Great. Sylvester, if you could expand or implement this anywhere, where would it be? And what's your dream for your next step?
Okay, thanks. So we've kind of benefited from the media channels we're using to achieve some great expansion already. We just started in Accra in 2011. But by virtue of using radio, so we had a program that hosted as Ultimate Health on Joy FM, and they have a wide listenership around the country. So we had people all over the country hearing us. So we wanted to expand to the major cities around the country beyond Accra. And I think we're achieving that. We're hoping that we can do a lot more. Also by partnering with the Chefs Association of Ghana, and we had chefs from 11 different countries in Ghana, and we had the opportunity to share the ideas with them. Many of them gave us feedback that we actually want to go start this in our country. So I think within the sub-region is also a beautiful dream to pursue. We'll do within Ghana and within West Africa.
So Meatless Monday will take over West Africa, it sounds.
That would be great.
Melinda, I know you're off camera, but are you able to tell us your dreams and where you would love to expand? And looks like maybe she is still frozen. All right, well, hopefully we can get her back in. So this is kind of the conclusion of the panel time. We're going to go into some questions and answers now. I'm going to ask my colleague Daphne to step in and handle the question and answers, and then for further discussion. I just want to recognize the fact that we have Dana from the Meatless Monday campaign who is on the call as well. And so if you have any questions, please reach out to her if you're interested in starting a campaign. We will also put our link to our we have a global site where you can share information globally and see what other partners are doing, chat, meet someone new. I'll put when you're doing the question and answer, I'll put the link for that site as well. So we are here and have a lot of resources for you to use as you start your own campaign in your countries or your regions. So Daphne, I hand it to you.
Yes. Hi, good morning, good evening, everyone. One of the questions that we had on our chart is, how was the Meatless Mondays project being received in Ghana? What has been the biggest obstacles? So I guess, Sylvester, that's one is for you.
Okay, well, so I think I talked about the issue of reaching the children. That was one, but we think that it's an obstacle that we can overcome. And we've had very great support from the policymakers, the Ghana Health Service. So that has been helpful. And we've also had a lot of support from the Environmental Protection Agency. So they have been policymakers that have been right behind us. But our biggest obstacle at this point has been reaching a lot of the children. We're hoping that we clear that obstacle soon. Thanks.
Okay. Very good. I would like to take the opportunity as well to introduce Robert Ansley, who has been our lead on this, which the center, Johns Hopkins Center for Communications Programs, and he has been awesome in leading us and guiding us and just kind of keeping everything floating forward. I do want to introduce him. So say hello to our awesome lead.
Thank you, Daphne.
You're welcome.
Thoroughly enjoying learning a lot.
Yeah, very good. I like it. We did have a comment from a nutritionist that said, I would just like to point out that vegan and vegetarian dietary patterns can be nutritionally complete and balanced. Malnutrition is a big issue indeed, but it is not only due to dietary choices. I mean, we do agree that is true. Malnutrition is a complex issue, especially when you're looking at low to middle income countries. But some, into definitely developed world, but it is definitely in low to middle income country, sometimes is access to the right, foods that is the issue, and also cost, and you know where you are. So yes, thank you for that comment, Elizabeth. And let me see.
I would just quickly add that, that's the beauty of approach like this, where you really can meet people where they're at and help them along their journey or their path, whether or not they want to go completely completely meat free, or if they like to still have meat in their diet. And so yeah, I do appreciate this approach. I see.
Yeah.
Melinda,
Melinda's back, but there's not, when it comes to, diet and food, there's never one size fits all. And so, in thinking about cultural perspectives, as well as, access, as well as just everything, it's a complicated issue. But culture is big, depending where you are. So we got to take all of those into account as well. Let's see. I don't know if you see on the website, on our chat, Dana has provided her email. So if you guys like to contact her, she is with the Meatless Monday team in New York. So certainly, if you want more information, if you're interested in starting the Meatless Monday, just get in contact with her. And as well as Becky put HiveBright, which is our community website, where everyone who's interested in meat reduction, he has a lot of resources in there as well. If you want to talk to others that have done it, you want feedback, or you want feedback from us as well. We're on the site as well. Just kind of keep that in mind. I think Melinda can hear us. So Melinda, do you have anything to add?
Melinda, you're still muted, I think.
Okay. So yeah, she said it's fine, but she,
Hello.
hear us. Can you?
Hello, can you hear me?
Yes, now I can.
Oh, okay. Yeah. Yeah, I just want to answer the last question. Sorry.
Very good. Go for it.
Yeah, I mean, like to expand, actually, you know, China is a big country and this project is only spreading in some big cities at the moment. So we hope that this campaign can extend into every city and every village in China so that everyone can develop the idea that eating healthy plant-based food can make a difference in mitigating climate change and also benefit people's health. So that's is our dream. So
Okay.
yeah, thank you.
Thank you, Melinda. I don't see any more questions.
That is a big dream. It's a
Yes,
big
that
country.
is a big dream. It is because it's a big country. But we'll support you for sure. We don't have any more questions. Any last minute questions? If you want to raise your hands, I do want to welcome everyone. I see we have our friends from Italy, Chile, gosh, just different places here. So I do like to welcome you. Some places in yes, South America is here. Indonesia is here, of course. So yeah, so I just want to welcome you and thank you for taking the time to join us late evening for some of you, some of us early morning. So grateful and thank you so kindly. I believe this is it. We're 11 after 8. Okay, good. That's not a question, but yeah, so 11 after 8. I think that concludes. Any last minute parting ways for us? Oh, wait a minute. There's a question from Foley. Apologize if I pronounce it incorrectly. Between children and adults, which group must esteem this campaign very well? So if you have between children and adults, which one I suppose correlate, with the campaign very well, that was that adapted very well? What would you guys say?
Are you going for that, Priska?
Right.
Right, so maybe I'll just start by saying that, sorry, go ahead.
Yeah. Please.
Okay, no, so what I was going to say was that there's a for everyone, for the adults, as you age, the risk of developing non-communicable diseases is very high. And so it's important to be conscious of what you eat and how you eat it. So Meatless Monday, and I think it's one of the big reasons why many people embrace it in Ghana. But for the children, if you build a habit of controlling how you eat meat and how you when you eat it, etc., right from childhood, you grow with it with ease. Now, we did say that they are also an important part of the behavior change communication channel. So I see them as major change agents in driving this campaign. And so it matters to the children and it matters to the adults. That's what I wanted to highlight. Thank you.
Okay, I just want to add something that Sylvester said just now. For me, if I have to choose between children and adult, can I choose in the middle, the young adult one? So yes, because sometimes the adult is very stubborn and it's very difficult to get new ideas, but the young adult is very keen to try the new ideas. And then we also targeting for the young mom actually, because we believe that this is usually in Indonesia, in the domestic parties also tackled by women, and the young mother is very, have a strong, very strong possible impacts to the community if they can have, provide balanced food to the family. So, well, we still in Indonesia, for the Meatless Monday Indonesia, we still try to go into the young adults, especially the young mothers, because in this case, it's very easy for us, like sharing recipes. And then I also agree with Elizabeth says just now, this is not only for the vegetarian or meatless food, but also how to prepare food to make the nutrition content is still there. So I think this is the most important for us. Thank you.
Yeah, in China. Hello, can you hear me?
Yes.
Oh, okay, thank you. Finally, I'm back. So actually in China, like adults is more easier than children because you know in the primary school and also in the middle school, the parents are very concerned about their nutrition condition. So if there's no meat, even one day, the parents have a lot of concern on it. And you know the dietitian tell them the very clear message to them, but they still cannot change it, you know, quickly. But for the college students and also adults, and they can make decision by themselves. And if they can have a clear idea about what we communicate with them, and they believe it, and it's much easier for them to make change. Yeah. Thank you.
Okay, very good. Let me just check again. I'm looking, so you see my eyes moving, so I'm looking at the chat. You know, was I listening to you guys? Let's see, children. Okay, children will normally do what their parents do, especially their mothers. So adults, mothers as a target group can be an effective change agent. Let's see. And Becky added a note with this money can be a different approach for different people. Some may do it to gradually shift their eating habits. Other may do it to save money. That's why we like to emphasize it is a gateway to get to your goal, right? It's not the end all be all, but it's a pathway, you know, so we can get at your goal, whatever that may be. But anyway, I think we're good. Well, we wanted to end at 8:15. We're at 8:17. Thank you so much for your time. This was awesome. Great discussion, very informative. Have a lovely night, some of you, and others, good morning.
Thank you again to the panelists.
Thank you.
Oh,
Thank
To the
you.
panelists. And Daphne, thank you for-
Mhm. Have a wonderful week.
Thank you.
Thank
Bye-bye.
you. Bye.